Hi all, it's Charlotte Appleton with Cesare Project. My question for today is, can we really know why healthcare fails? It is so complex with so many factors. It's hard to imagine that there is a single underlying matter that connects all of it. Almost every adult has their opinion about why healthcare is the way it is. Some think it's related to all of the factors that interfere in a doctor-patient relationship, including government policies, insurance considerations, or access to care issues. Others point to the influence of big businesses like the pharmaceutical companies or biotechnology. Unfortunately, pointing fingers and placing blame solves nothing. Even if all of these agencies or factors weren't involved in healthcare, healers still couldn't reverse or cure chronic diseases. By reframing the question to why is healthcare so complex, today we can make new inroads. The complexity we experience in healthcare has evolved over the past century. Research about disease has led to more interventions, vaccinations, public health policies, medications, and advice that are all trying to combat the same thing. What is it? It's two words: disease uncertainty. When we stop and recognize that agencies are trying to decrease disease uncertainty, we appreciate that they're all coming at it from different angles, but none of them are particularly effective. Unfortunately, all of these policies and campaigns end up creating frustrating pinch points and significant financial concerns that distract attention away from the problem that we're failing to address: disease uncertainty. So let's talk about what disease uncertainty is. It really has two flavors. One is on an individual level. It's a feeling, it's a state of being about not knowing or being able to anticipate what is going to happen. When it comes to disease, there is no true certainty. For example, any individual cannot be certain that they will develop diabetes or breast cancer. In that way, our failure to understand disease cannot answer a lot of questions on the individual level. Who will get a certain chronic disease? What chronic disease is an individual really at risk for? What chronic disease will they develop? Why does an individual develop a particular disease? When will that disease manifest? Will it manifest? Today, there's a lot of information filling the void of disease uncertainty that perpetuates strategies that try to help people reduce their disease uncertainty. People may take a medication, use a more natural substance, or eat organic foods in an effort to reduce their disease uncertainty, but unfortunately, there are surprises all the time. A lot of times in diseases that are poorly understood, it's really a game of roulette. Who's going to develop dementia? Who's going to develop pulmonary fibrosis, which is a condition where the lungs begin to scar down that we have no idea why that happens. Other conditions like heart disease and diabetes we think we have a handle on, but the truth is they're still very uncertain on an individual level. Today's solution is to deal with disease uncertainty at a population level, using statistics and risk models and finding these criteria that seem to come together and be factors in a population's trend toward a particular disease is an attempt to deal with disease uncertainty. Unfortunately, it doesn't work that well, and it doesn't translate to the individual level at all. A population study may say that 1 in 100 persons under a certain set of circumstances is likely to develop a particular disease, but who's the one person? When is it going to happen? Nobody knows. That's disease uncertainty. It seems that today, in light of all of the available options that try to impact disease, has increased disease uncertainty. It's very difficult for providers and patients to make a meaningful choice amid all of the considerations, drugs, procedures, and yes, financial considerations, which makes it difficult to make a meaningful choice or predict if a particular intervention is going to meaningfully help an individual. The matter is further exacerbated because in calculations, risk models, and science, uncertainty isn't a feeling or subjective quality per se. Instead, it measures the degree of doubt. For example, if a value is obtained, the uncertainty is the range around that value that determines how true that value is. In this respect, any uncertainty that creates sort of a fuzzy output is attributed to a limitation of an instrument, of its ability to measure a value, or to human error. This is not the same uncertainty that we're talking about an individual's feeling of wondering what's going to happen. When we talk about risk models and population statistics, It uses the objective uncertainty that defines it in terms of measured values. When we frame disease using the objective version of uncertainty, it completely sidelines the subjective experience of uncertainty. I think this misunderstanding about what uncertainty is where healthcare has really gone wrong. The obsession with reducing statistical uncertainty in a quest for perfect data misses that it's not reducing disease uncertainty. Better data does not combat disease. When uncertainty is simply a calculation problem, it overshadows that it is subjective uncertainty about disease that is sending off bells and whistles and sirens that what we are doing isn't working. Disease is rising. People are more uncertain than ever. Better data and more accurate measurements don't solve that. In that respect, disease uncertainty is driving healthcare. When someone is uncertain about disease, they look for solutions to help reduce that disease uncertainty. The healthcare system has grown to try to meet that demand to reduce uncertainty. Unfortunately, the uncertainty keeps rising and the system becomes ever more complex trying to reduce that uncertainty without recognizing that it's creating a positive feedback loop in which all of this complexity is adding to disease uncertainty. And despite that, we're turning to our measurements and saying, well, our data is the problem. No, the paradigm's the problem. That we cannot explain disease is the reason we cannot reduce disease uncertainty. Nothing we are doing in healthcare is going to reduce that uncertainty. Furthermore, the solution to this mess isn't in the current paradigm. If it were, we would have found it by now. Instead, the healthcare system has grown so complex in light of massive disease uncertainty that any attempts to try to decrease the complexity of the healthcare system is gonna fail because you've done nothing to reduce disease uncertainty. Any attempt to reduce complexity creates a vacuum between the two. That lends to the expectation that something in today's science is going to fill that vacuum in a way that is more successful than what we're already doing, but it won't. The solution is to lead with disease uncertainty by decreasing disease uncertainty, which means understanding disease and creating interventions that work to reduce disease uncertainty and remove disease. Only then will the complexity come down. Unfortunately, that is not possible with today's knowledge. We first have to establish a paradigm that can reduce disease uncertainty. And the only way to do that is to understand disease, and the only way to do that is to understand life. There are important elements that we continue to exclude over and over in today's paradigm that are just going to continue to fuel the fire of complexity, disease uncertainty, and dissatisfaction. However, as long as we think that subjective uncertainty is part of the problem and part of what's messing up our calculations, there is no hope for a better future. Instead, we need to recognize that disease uncertainty is the driver. When we reduce disease uncertainty, health will follow, as will a healthcare system that can positively impact the ravages of disease. This requires a total reframing of the role of what we call subjectivity today in an otherwise objective interpretation. Today it has no role, which is a fundamental problem. It can't be reintegrated despite campaigns for patient-centeredness or increasing the patient's voice. It has to come from understanding. On the other side of that is a paradigm of life that leads to a healing future. Thanks for listening. Please be sure to like, subscribe, and leave your comments below so I can continue to make videos that interest you. Have a great day.